Welcome to Around the Couch. I'm Jeff Kallis from KidneyCouch. This episode is about the exciting news that KidneyCouch has formed an affiliate relationship with the Kidney Cancer Association. The agreement to be affiliated with one another was signed in October of 2025. KidneyCouch is now one of 8 members of the Kidney Cancer Association Affiliates Program. KidneyCouch is honored and proud to be part of the Kidney Cancer Association's affiliate program and all it does to advance kidney cancer awareness and fund researchers looking for a cure for kidney cancer. This affiliate program agreement marks a significant milestone for KidneyCouch. The Kidney Cancer Association is the internationally respected leader for kidney cancer awareness and funding groundbreaking research to find a cure for renal cell carcinoma, or kidney cancer, and end this deadly disease. I first became aware of the Kidney Cancer Association shortly after I was diagnosed with stage 3, grade 3, clear cell renal cell carcinoma in January of 2023. In November of 2022, I started to have symptoms that I hadn't experienced before. I had pain in the left side of my lower flank. The pain gradually gravitated to the middle of my abdomen a few weeks later. Then there was blood in my urine, just a little at first. Then 4 days later, a little became a lot, and darker. I decided it was time to tell my wife Cindy that I was passing blood. I'd never passed blood before in my 61 years. So I knew something was not right within. I called my primary care physician's office and requested some urine and blood tests. I was sure that I had a bladder infection of some sort. Never had one before, but it sure felt like one. When my primary care physician, Dr. Andrew Greenland, reviewed the lab tests, the urinalysis showed red blood cells in the urine. The white blood cell count in the urine was normal. Dr. Greenland told me that that meant I was not dealing with an infection, so a urinary tract infection was ruled out. Dr. Greenland's preliminary diagnosis was that I had either passed or was passing a kidney stone. He then ordered a CT scan of my abdomen and pelvis to confirm the kidney stone, as well as rule out something more sinister causing the blood in the urine. I was fairly certain all I was dealing with was a kidney stone or two. The more I thought about my symptoms the past 2 months, having a kidney stone made sense. But my mind wandered a few times about something more sinister. I was smart enough to figure out on my own that that meant ruling out cancer somewhere in the abdomen. 5 long days later, I had the CT scan with and without contrast. I had never had a CT scan before. X-rays of my hand and foot, but no CT scans. Before, during, and after, my anxiety was off the charts. Very little sleep the night before the CT scan didn't help much either. 2 hours after I rolled myself off the bed of the CT scan, my results showed up in my patient portal. Not one to wait, I looked at the radiologist's findings before my scheduled appointment with Dr. Greenland that afternoon. Sure enough, the CT scan found a 6-millimeter kidney stone in my left ureter, lodged at the entrance to the bladder. That stone was not going anywhere without a little push or a blast. It explained why I was having pain in my left lower flank. But as I kept reading the report, I realized that there was something more sinister. There was a 5-centimeter mass in my right kidney, consistent with renal cancer. I was at a total loss for words. It's why the doctor recommends not reading a CT or MRI without a medical professional with you, both to answer questions and not have you fall apart with no support around you. My wife Cindy was home when I read the report. She was all the support I needed, and boy did I. I went on to have a radical nephrectomy. I had great support from Cindy, our boys, our family, and friends, but I was missing a connection with others like me. kidney cancer patients who knew firsthand what I was going through. One of the first organizations I reached out to was the Kidney Cancer Association. I was searching for educational material and answers to the many medical terms and recommendations, in addition to what my healthcare team provided me. The Kidney Cancer Association had an online Facebook group called the Kidney Cancer Information and Support Community. In addition to this group and others like it, the Kidney Cancer Association has a wealth of information on its website. I found information about everything from the kidney itself and kidney cancer basics to commonly used terms, facts, signs, symptoms, and risk factors. The Kidney Cancer Association's website is professionally done and is a great support to someone dealing with kidney cancer. You might want to check it out at kidneycancer.org. I would later reach out to the Kidney Cancer Association and provide a few patient stories about my journey, to be a part of a few social media campaigns that were initiated at Kidney Cancer Association, and become a Kidney Cancer Association ambassador in January of 2024. In April of 2025, I was asked to be one of the grant reviewers for the 2025 Kidney Cancer Association Research Awards. And during that time, I continued to produce media spots for the Kidney Cancer Association. It was this history that led to the current step. KidneyCouch is now an affiliate of the Kidney Cancer Association, an affiliation that KidneyCouch is very proud of. So what does this affiliation program agreement mean for the KidneyCouch? Well, first of all, KidneyCouch will serve as the Rochester, Minnesota ambassador for the Kidney Cancer Association, developing an annual awareness or fundraising event in partnership with the Kidney Cancer Association to support kidney cancer research. Right now, I'm busy working with a couple of businesses in Rochester to create an awareness campaign for the month of March 2026 for Kidney Cancer Awareness Month. KidneyCouch does not independently fundraise and will direct all fundraising efforts to the Kidney Cancer Association. The purpose of KidneyCouch is to raise awareness of renal cell carcinoma and provide a research library for education and awareness, as well as inspirational stories and thoughts. Also, KidneyCouch will create and share periodic social media and community content, both independently and in collaboration with the Kidney Cancer Association, to raise awareness and highlight Kidney Cancer Association's mission, funding opportunities, and events across regional platforms, on social media, print, and through online publications. My kidney cancer experience isn't anything special. So many patients have gone through what I have or worse. In fact, in 2025, there will be about 81,000 new cases of people diagnosed with kidney cancer in the United States alone. Patients are being diagnosed at an earlier age, and their stage of kidney cancer, with the advancement of technology and increased awareness, is helpful. But, like my case, most kidney cancer cases are diagnosed incidentally, by accident, when physicians are looking for something else with a CT or MRI. Kidney stones, in my case. If it hadn't been for the kidney stone lodged at the entrance of my bladder and refusing to move, I may still not be aware of the kidney cancer growing in my right kidney. I had no symptoms from the kidney mass itself, a silent killer, if you will. My cancer was stage 3 by the time it was discovered. The mass would have spread beyond the kidney, in all likelihood, and with that, decreasing the chances for recovery. Surgery to remove the tumor probably would not have been enough. Improvements in early detection, as well as finding a cure for kidney cancer, when it is found, is what makes the work of the KidneyCouch and organizations such as the Kidney Cancer Association so necessary and important. Strength and unity, as I like to say. Well, cancer isn't idle, and neither is the KidneyCouch. KidneyCouch will continue to evolve with great organizations like the Kidney Cancer Association to raise awareness of kidney cancer, provide education and resources, and work together to stop kidney cancer in its tracks so future people and generations won't be touched by this disease and the negative impact it has. Thank you for listening and sitting with me around the couch. I'm Jeff Kallis from the KidneyCouch. Join us next time around the couch.